somebody doesn't understand just turning 65, that's a great little sheet to give to them so they understand the difference between a Medicare supplement and a Medicare Advantage. One of the biggest things that I do, I always tell my clients, is my biggest thing is education. I want my clients to understand. If my clients understand how all of this works, I mean, without confusing them, but they understand how supplement works, Medicare Advantage plan works, they're going to be a better client for me. Because they're going to understand how their health insurance works, how their life insurance works, how their long-term care. If they understand that, then it's going to be a better decision-making client. They're going to understand how their needs are and kind of what they need to have. Especially when it comes to life insurance. They understand the difference between their term and whole life and final expense and universal life and everything else. You're not going to have a client that's ever going to call you, confused and not know what they have. So, much better. Alright, we're going to go over hospital indemnity, which is the first couple of pages. Then I'm just going to briefly go over a couple of different things that we don't talk about very often, which is cancer, critical illness, stroke, heart attack, things like that, and also dental vision plans. We have more than the one that we share with you on all of these, but hospital indemnity, GTL is my favorite company. I like GTL because I've been using them for a few years, and with hospital indemnity, and I've never had a problem with paying claims. And to me, that's the next important thing. When you have a hospital indemnity, you need to make sure it's going to pay. Because it's no good to pay premiums for something that's not going to pay out and help you when it comes to hospital indemnities. So GTL does very, really good. Also, I like GTL because they now have an online portal, so you can apply online, which is great. We're trying to get mostly to electronic applications here the next year or two. I'm going to start to really lean on that a little bit. We didn't talk about too much today because I want to get the fundamentals down. But later on, when I talk to the group, Ronnie mentioned it yesterday, they have one called Lean for United Healthcare. You can do all of your enrollments for United Healthcare online. Humana has one now. North American has one for life insurance now. GTL has one for hospital indemnity, Medico for dental vision. So you start using these portals. The cool thing is you never have to worry about an app being out of date. You never have to worry about you making a mistake and have to run back to a client's house to get a signature because it won't let you move on without everything correct in the online portal. So I like it, and it goes much quicker. I mean, a lot of them now, the dental vision plans, even the hospital indemnity, they give you a policy number right on site. So if you're using a tablet and you're doing it online, you're literally getting a policy number in the house. Here, Mrs. Jones, here's your policy number. We'll have the policy out to you in about a week or two. But here's your policy number. You're going to be covered as of October 1st the way you want to be covered. That's pretty cool to be in the house and be able to say that. I mean, a lot of times you're walking away, they're applying for life insurance, they're applying for a Medicare supplement or something else, and they don't know until they have it in their hand. So to walk away and say, here's your policy number, like, wow, it's already approved? Yeah, that's how I roll. It's all good. Hospital indemnity. Hospital indemnity is big on Medicare Advantage. It's not going to deal with Medicare supplement at all, because if you remember, it said Medicare supplement doesn't have any copays. It's also as close to 100% coverage you can have, so you're not going to need a hospital indemnity. Hospital indemnity, if you went back to your Humana, we're going to use Humana as an example. Again, not the only Medicare Advantage company, but I want to use it as an example. They have a $260 copay inpatient hospital. So if you went to the hospital for 3 days, you're paying $260 times 3. Well, a lot of people may not have $1,000 set aside, or $1,500, or $2,000 set aside because they're on fixed income. They're making $1,500 a month. How long would it take them to have $2,000 on the side? It'll take a lot of saving up to do that. So a lot of people would rather pay a little bit extra premium to know they're covered. And that's where hospital indemnity comes in. A hospital indemnity, GTL is who I like to use for the hospital indemnity. We do have other companies, Equitable, Cigna, American Retirement. There's a couple other ones, but I like GTL because there's things that are used. It provides cash benefits for daily hospital confinement, ambulance, outpatient surgery, skilled nursing, cancer. So I like to use the daily hospital because if your Humana has a $260 a day in the hospital, I want the daily hospital part to cover that. So I want to make sure that it's going to at least cover $260 a day in the hospital. I also like the ambulance benefits. And I do because majority of the time, how do you get to the hospital? You normally get a ride, not by taxi, but by ambulance. Normally. Not always. I mean, sometimes some people are really bright and try to drive themselves, but you know, normally it's by ambulance. And I also like the skilled nursing facility. Because what's the other part that's really expensive? We talked about $152 a day once you're past 20 days on skilled nursing or rehab. $152, 10 days is already $1,800, $1,900. And so the skilled nursing is the other thing. I try to take away what's the most expensive. On that Humana plan, if you go back and remember, we talked about outpatient surgery. Outpatient surgery is only $210 copay. I think that's pretty good price for outpatient surgery. So I don't want to have something to go in and make your premium higher for $200 coming in your pocket. So I want to make sure I limit all your major stuff, but I'm not covering going to the doctor, I'm not covering going to specialists, I'm not covering the things that you can't afford. Trying to keep your premium down as low as you can. So your hospital indemnity matches up with your Medicare Advantage and takes away all the major costs that would come up with your Medicare company. Normally if somebody's turning 65, a hospital indemnity to cover that is somewhere between $35 and $40 a month. So on this plan, this Humana plan, we're using an example, this plan is $15 a month, and it costs an extra $35 for the hospital indemnity together to make sure that you're as covered as you can without going to Medicare supplement. In this example, it may cost $50 a month. $50 a month versus the $200, maybe a lot more affordable for somebody to make sure they're covered pretty well. Is that computer done?